Medical waste is any type of waste that contains infectious material or material that could be potentially infectious. The definition includes waste generated by healthcare facilities such as physician offices, hospitals, nursing homes, blood banks, and vet clinics. The types of waste include sharps, which is anything that can puncture the skin, such as syringes, needles, and disposable scalpels. It also includes infectious waste, which is swabs or lab samples, radioactive waste, which is unused radiation liquid and anything contaminated by this liquid, pathological waste, which can be categorized as human fluids or human body parts, pharmaceutical waste, which is unused or expired vaccines, drugs and antibiotics, chemical waste, which is disinfectants used for lab chemicals, and genotoxic waste, which is usually carcinogenic and it's from treating cancer. 85% of medical waste is non-hazardous, but the remaining 15% are hazardous material that may be infectious, toxic, or radioactive. This poses an extreme problem because only 58% of healthcare facilities have adequate disposal systems in place. All individuals exposed to the hazardous waste are potentially at risk, including those within the establishments that generate the hazardous waste, and those outside the healthcare establishments that handle the waste or those exposed because of the not responsible management. These individuals include medical doctors, nurses, healthcare auxiliaries, and hospital maintenance personnel. It also includes patients in the healthcare establishments or those receiving home care. It includes visitors to the healthcare establishments, workers in support services allied to the healthcare establishments, such as laundries, waste handling, and transportation, and workers in waste disposal facilities, such as landfills or incinerators. And it also includes scavengers that are going to these facilities looking for things that will help them in their lives. Since infectious diseases can enter the body in multiple routes, such as punctures, abrasion, or cuts in the skin, and through mucous membranes, inhalation, and ingestion, medical waste that is not disposed of correctly has many avenues to potentially cause someone to get sick with a serious disease. Some serious health risks include hepatitis C, hepatitis B, HIV, radiation burns, sharps-inflicted injuries, and toxic exposure. Medical waste can also have many impacts on the environment. Biohazardous waste that is not disposed of properly can end up in lakes, parks, and other wildlife refuges where birds and other animals live. It is thought that wildlife are attracted to the pharmaceutical scent and color, which results in the animal digesting the medicine. Mishandled medical waste is too much for even the best landfills. Sharps can rip the lining of the landfill, and when the rain comes, the contaminants can leak out into the outer soil, which causes the contamination of the groundwater. When people are disposing of radioactive materials dangerously, it creates a major problem for humans and other wildlife. Overexposure to radiation can lead to serious diseases and health risks. And although a lot of hazardous waste is disposed of by incinerators, if it is not done properly, the pollutants can move through the air. Air pollutants spread much faster than any landborne pollutants. In the United States, the medical waste problem is linked to the expanded use of disposable items, which became popular in the 1990s with the AIDS outbreak. This is no small problem considering that medical waste is the third largest source of waste in the United States, with hospitals discarding more than 2 million tons of waste annually. Medical waste is primarily regulated by state environmental and health departments. EPA has not had authority specifically for medical waste since the Medical Waste Tracking Act of 1988 expired in 1991. It is important to contact your state environmental program first when disposing of medical waste. The citizens of the United States are very lucky because they are one of the only countries that has a substantial medical waste disposal system. Developing countries have poor funding and lack of national regulations for sanitary disposal. They also struggle because of the volume of disposable wastes. Since their supplies are limited, they often don't sort the waste and dispose of all types of waste in a sanitary manner. Many people go to the disposal sites that often do not meet regulation and scavenge for goods. This puts them at very high risk. India is a country that has a major problem with disposing of medical waste. The government passed biomedical waste management and handling rules in 1988. These rules outline how hospitals should handle, collect, and dispose of waste, yet it still gets collected with general waste and dumped in the open. Most countries in Africa are also part of the medical waste disposal problem. The United Nations Developmental Programme's Global Healthcare Waste Project is researching ways to help sub-Saharan Africa better dispose of medical waste. Most of the countries surveyed lacked legal policy for medical waste management and lacked proper sanitary landfills. Lack of sanitary landfills has led to greater use of incinerators. It is estimated that there are more than 1,000 incinerators in Africa, many of which have reported to be inoperative or operating below standards. Even though this is a great problem all over the world, there is still a way to move forward. Many hospitals are starting to look into recycling or donating leftover supplies that are still usable to developing countries, many of whom are in desperate need for these supplies. The World Health Organization recommends promoting practices to better handle, transport, store, and collect medical waste. These practices include correctly using the color-coded bins and trying to implement more non-incineration systems of disposal. The main thing that we can do to improve the medical waste problem is to raise awareness and educate ourselves and the world on the problem. The more people that know of the issue and how to move forward, the better chance we have of eradicating it.